Hi, my name is Steve Damasco. I'm going to talk a little bit about therapy because one, my graduate degree is in psychology, so I've studied it my whole life. And two, I get asked a lot about therapy. And there are basically two types of therapy. There's what they call psychotherapy, which we're all trained in, and then there's cognitive therapy. The difference between the two, to make it a simple definition, is that psychotherapy is where you go in and you see a therapist and you talk about your life, like everything that happened, everything that bad happened to you, everything that good happened to you. And basically, why are we there? We're there because, why did we go to therapy? Because we have a behavior that we're trying to change. We're trying to feel better about who we are, what we do, why we do what we do. And then there's the cognitive therapy, which is my kind of therapy. That is, where are we in life now? What is it, the behavior that you don't like or we don't like about ourselves at this moment, at this time in life? And why do we keep repeating some of the behaviors that we're not happy with? And then you say, okay, where do we go from there? What is it I have to do step by step to change that behavior? You gotta remember, we're programmed. I told you before that the conscious, unconscious stage where we know what we don't like and we don't know why we don't like it is implanted in that brain of ours. So we need to reprogram, and reprogramming is very, very difficult. But I like cognitive therapy because I told you before that my definition, how I've changed my life. I had a very severe life. My mother had a very severe life. My sisters had a difficult life growing up. So how did we move forward? How did my sisters live a happy, productive life? How did I move forward? People ask me this all the time. How did you get out? All your friends are either dead or in prison, and you've done so many things with your life. How did that happen? Well, it happened because I looked at my behavior, I looked at what I wanted to change, and I moved forward with it. And I kept repeating these things just like a technique, a martial art technique, same way, okay? I can show people how to defend themselves in 30 seconds, but you gotta do it 10,000 times before you can do it under pressure. And the brain works the same way with behavior, and we'll talk about that some more.